everyone. Thank you for joining us. This is Dr. Tracey McCarthy. As we exit 2024 and we enter 2025, I just want to cover a topic that we haven't covered in a while, and it's related to children, but it touches on the topic that we are currently addressing, which is psychopathy. And so, what I want to address are those risk factors that we were addressing previously related to anatomy and physiology and also genetic dynamics. I want to touch on epigenetics. And so this is very important to consider when looking at these risk factors. There are some things that outside of the physiology, outside of the anatomy, that may impact these risk factors related to later adult outcomes. And so the topic I want to address is the abuse of children. And I'm just going to cut to the chase. People need to stop beating children. This is particularly the case when we are considering little boys. And when I say little boys, I mean baby boys. Children are being abused at an alarming rate. People have all sorts of excuses for why they feel the need to beat children. And I've heard all of the explanations. It doesn't matter what the explanation is. People need to keep their hands off of children. They need to stop doing to children what they would not want another adult doing to them. People are not crazy. People know good and darn well that when you hit someone that you are traumatizing them. And many people, when they hit children, the intent is to traumatize. Now, many people believe that they have an ownership sort of right with respect to children. And so therefore they believe they can do anything that they want to do to children. Interestingly, however, those same individuals don't want to deal with the later outcomes of abusing the children. And psychopathy is one of those dynamics that might be a later outcome with respect to children. There are impacts on the brain when children are spanked. And we are not talking about parents or adults who are hitting children in the head. We are talking about just general spanking, traumatizing the body with physical abuse and physical pain, that trauma response. And you can see some of that information in some of these articles that are going to be presented. But I want to just stick with this particular message. People need to stop beating children. This article, which is a Harvard article, indicates that spanking of children has negative impacts on children. It impacts social and emotional development, the ability to self-regulate. One of the things that happens with psychopathy is this onus of responsibility being projected to the external world, and this sense of not having complete control over the self. And so some of that is exacerbated when children have experienced abuse in childhood. And so therefore there are problems with self-regulation. There are also implications for cognitive development. Now, some people will, again, say that they have the right to do this, but people, generally speaking, don't want to deal with the outcome or the consequences of these freedoms. There are consequences to beating children. And so if individuals want smart children or smarter children, they would do well to not do anything that's going to preclude the children from being smart. And spanking can alter the way that the brain is actually functioning. The article goes on to indicate that spanking elicits a similar response in children's brains to more threatening experiences like sexual abuse. Yes, you probably hear fireworks going on there. You can see the same reactions in the brains when spanking takes place. And so, therefore, one of the things that happens with children is they start to become hyper alert with respect to threats that may not actually be real. So they are hyper vigilant. They become more hyper vigilant when they have been spanked. The National Children's Alliance has indicated that the trauma of child abuse causes children to lose their sense of safety and trust in the world and harms their relationships. It not only can harm relationships when they are growing up and relationships with the parents, but it may also have an impact on relationships in adult life. There is a confusing message that is being sent when someone spanks, hits, beats a child, and does it, when someone does this, and they call it love. And so, therefore, it's confusing to the child because now they have to reconcile this abuse love paradigm that has been presented to them. It makes no sense. Love is not abuse. And so, therefore, parents, adults, caregivers need to really think about what it is they are presenting when they are presenting that fallacy to children. What are going to be the implications? What are little boys going to grow up thinking with respect to male female relationships and what abuse really means? Because they've been given the message when they were younger that abuse with respect to a woman is the same thing as love. Okay, can you see where the problem is there? I'm sure you can. So the National Children's Alliance goes on to indicate mental health problems like depression, anxiety, and PTSD symptoms are prevalent for individuals who have been abused. You can also expect behavioral changes like substance use disorders, risky sexual behaviors, and increased risk for violence against oneself and others. Violence against oneself would be self-harm. There are also problems with physical health, like infections and injuries, and even later on in life, heart disease and diabetes. And so, when individuals are deciding to journey down this beating pathway, they need to really consider the implications for doing so. It's not just as simple as spanking a child and then it's over and there are no negative repercussions. There are negative repercussions, and people need to stop and think about the potential for those negative repercussions. If people really think about what would be going on if they were being hit once a week or twice a week, beaten with a belt, beaten with a switch, hit with a shoe, slapped, punched, if those things were happening to them from someone who claimed to love them, they would probably be having some negative repercussions. And here are a few things to think about with respect to spanking, child abuse, and domestic violence. Child abuse is a form of domestic violence. And so you have adult partner violence, but then you have child abuse. And with respect to domestic violence, it indicates here that domestic violence is a pattern of abusive behavior in any relationship that is used by one person, one partner, to gain or maintain power and control over another intimate partner. Spanking is an attempt to gain power and control. And so when you're talking about domestic violence, you can see how spanking fits right under this domestic violence umbrella. It's interesting how they use a term like spanking versus beating. And so therefore, when people use terms like spanking or whipping, it's supposed to sound better than a beating. it's the same thing. Okay. And so, with respect to child abuse, what you are also looking at, just like with domestic violence, you are looking at behaviors on the part of the person who is perpetrating the harm, behaviors that serve to intimidate, manipulate, humiliate, isolate, frighten, coerce, threaten, hurt, injure, or wound. And with respect to physical abuse, there is a high propensity for injuries to take place. And sometimes you will be able to see the injuries. Whipping leaves injuries. We're talking about bruising, laceration, cuts on the skin. All of those things are trauma. And here in this pediatrics article, it provides a little bit of information about some stats. It indicates here that overall, 57% of mothers and 40% of fathers engaged in spanking when children were age 3, and 52% of mothers and 33% of fathers engaged in spanking at age 5. Maternal spanking at age 5, even at low levels, was associated with higher levels of child externalizing behavior at age 9. Externalizing behavior is another way of saying acting out. And so bad behaviors that you would see, misbehavior with respect to children. And this is even after an array of risk and earlier behavior indicators were controlled for. Fathers' high frequency spanking at age 5 was associated with lower child receptive vocabulary scores at age 9. Again, this is going to that correlation between the spanking and cognitive development. And so while it may seem important to correct a child behavior in a moment, parents need to consider the implications for overall development. And here they address the issue of the links between spanking and child aggressive behavior. In other words, children being aggressive subsequent to being spanked, and also problems with vocabulary. And this is a brief article that you might want to check out, and it's coming out of Yale Medicine Magazine, and it's on the epigenetics of child abuse. In this article, they address that abuse can change the way in which genes are expressed. And so remember, we were talking about the anatomy and the physiology and the genetic manifestations that might put a child at risk for developing psychopathy later on. Well, it's indicating here that there are epigenetic factors related to child abuse that one needs to consider. That means that the expression of the genes, the expression can be impacted by child abuse. And so there are factors outside of the genetic landscape that impact the way that the genes are expressed inside of the body. And some things can have a positive impact. In other words, they can mitigate risk. So a lot of nurturance, love, good healthy food, clean air, those sorts of things can mitigate risk. But things like spanking and abuse, physical abuse, emotional abuse, sexual abuse, psychological abuse, spiritual abuse, all of those things can have negative impacts. And what's also interesting about the epigenetic factors is that some of those things can then be inherited. Okay, so when the gene expression is changed in one child, it can not only impact that child, but it can impact subsequent generations that come from that child. And here they give a nice, concise understanding of epigenetics related to child behavior and the environment. It indicates epigenetics refers to how your behaviors and environment can cause changes that affect the way your genes work unlike genetic changes, mutations, epigenetic changes are reversible and do not change the sequence of DNA bases, but they can change how your body reads a DNA sequence. That's deep. The article goes on to indicate epigenetic changes are long term, and these changes can be passed down to children and grandchildren. But the effects of adverse childhood experiences don't have to be permanent. And so there are critical periods wherein the abuse might have a greater or lesser impact on the child and the child's brain development. Now I'm going to quickly go over some of the characteristics of perpetrators of child maltreatment, and this is from data from the Office of Juvenile Justice and Delinquency Prevention. It indicates that the majority of individuals who perpetrated child maltreatment, 82% in 2022, were between the ages of 18 and 44 years old. And so the individuals most likely to perpetrate child maltreatment are those in the young adulthood years. And so we're talking about relatively young parents. And this is some race and ethnicity data with respect to spanking. And it indicates that with respect to individuals identified as white, we have 55%. Black 70%, Hispanic 54%, Asian 37%. It's unclear what this other is all about, but 63% for other. What's noteworthy here, of course, is that we have the 70% for Black, and this is not the group that has the highest number in terms of population, and so that number stands out. When you look down below, you also see that Asians have the lowest rate with respect to spanking. Now, some individuals believe that many children need spanking, or that it's okay, or that people turn out just fine after being spanked. There are some things that certain groups can't afford. And so everybody might be spanking, but certain social and cultural groups already have other risk factors that they are dealing with, and risk factors such as spanking will just send things right over the edge. And so it's a luxury, if you will, this spanking that many parents engage in. It's a luxury for parents who would be considered Black or African American or brown. It's not something that they can afford. It's not something that their children can afford. There are too many other risk factors in operation, and so therefore they don't have that luxury that many other groups have with respect to the choice to spank. And here you can see that neglect is at the top in terms of the forms of maltreatment that children have suffered at 74%. And of course, with respect to neglect, there are also socioeconomic issues at play. And so therefore, when people don't have resources, children are more likely to be neglected. This is very interesting given the positions that many people hold related to abortion. Many people care a lot about unseen children in the womb, but they don't have that same care or concern for children who are out of the womb. And if a woman is wanting to have an abortion and that woman is not allowed to have that abortion, you can best believe that the children very often that are born are going to have some struggles, because you're talking about a parent that does not want the child. They did not want the child. Now, people can come up with all sorts of things and thoughts that they have about individuals need to follow through with having the children once they have created them. That may be the case. However, people also need to consider reality. And the reality is you're talking about a person who did not want the child. If you add to that financial difficulties, emotional instability, parental instability, family instability, you've got quite a mix going on that's going to be detrimental for many, many children. Physical abuse comes right after neglect, followed by sexual abuse. What's also noteworthy is that with respect to the maltreatment victimization rate by race and ethnicity, you have American Indian, Alaskan Native at the top, the highest rate. And right after that, you have Black. And farther down below, you see Pacific Islander, Hispanic, white, and Asian. Asian with the absolute lowest rate. This is interesting when you look at the information about the cognitive development again, because you will often see that Asian children, many Asian children, East Asian children in particular, will have higher scores on tests and things like that and have higher academic achievement. And so there's this correlation between that higher academic achievement and lower rates of abuse. And when you think about academic achievement and cognitive development for American Indian and Black children, Alaskan Native children who are suffering this maltreatment, these high rates of maltreatment, their cognitive development is lower, social development more challenged, adult outcomes lower, but these are the children who have been spanked. Okay, so it's something to keep in mind. Another thing to keep in mind is the age distribution of child maltreatment victims. And what you see here is that the majority of maltreatment occurs prior to the age of 1. Okay, so you can see the distribution there. And so then the rate starts to go down, but it is highest when the child is the youngest. And so when the child is most vulnerable, that is when the child suffers the greatest amount of maltreatment. And naturally, it starts to plummet and go down significantly by the time age 17. And there are a number of reasons for that, of course. And you can also see here with respect to child fatality victims that the majority of fatalities of babies, these fatalities occur under the age of 1. Not only do you have young babies being at higher risk for victimization, you also have male children being at higher risk for victimization. So we are talking about male babies being maltreated at a 60% rate and female babies or female children being abused or maltreated at a 40% rate. And so these again are things to consider. So you've got Black or Native American, American Indian children with these highest rates of maltreatment. And then you have male children with the highest rates of maltreatment. And here it indicates that the majority of maltreatment fatalities are coming from instances of neglect. And then that's followed by physical abuse. And here you can see the information on child fatalities with respect to the relationship. And so with respect to the relationship, 82% of child fatalities are perpetrated by the parents. With respect to mother only, coming in at 30%, father only 15%. And so mothers are more likely to be found guilty of child maltreatment and also of fatalities with respect to children. Now, of course, there is a confounding variable going on here because mothers are more likely to have custody of the children for a number of reasons. But mothers would be with the children more, and so there would be a higher likelihood that abuse would occur at the hands of the mother. And we're talking about physical abuse. With respect to sexual abuse, it tends to be more male dominant. And here you can see that breakdown of perpetrator data indicating that the highest rate for perpetrators is between the ages of 25 and 34, followed by 35 to 44, and then 18 to 24. And again, you have a slightly lower rate for males versus females. So as we exit 2024 and enter 2025, a few things to keep in mind are: what are the things that are needed for self-repair? Again, we've been talking about the dynamic of reparations and how reparations can take place. And one of the first forms of repair is self-repair. I want you to keep something else in mind. No one else is ever going to make you more important to them than you make yourself. And so no one else is going to make your healing, the healing of your family, the healing of your community, they are not going to make that healing more important to them than it is to you. And so with respect to harm that children have suffered and are suffering, no one is going to make the suffering of a community's children more important to them than it is to the actual community. And so with respect to healing, the first healing needs to be self-healing. And one of the things that needs to take place with respect to self-healing is people need to see themselves as worthy of healing, as worthy of love, as worthy of good treatment, not worthy of abuse. And when individuals are spanking, neglecting, beating children, their own children specifically, they are beating and abusing themselves. The child is made up genetically of the parents. And so when this hitting takes place, when the beatings take place, when the name calling takes place, this really is abuse against the self. And sometimes the child serves as a reflection of self. Oftentimes children are even named after their parents. And so these are some things for people to keep in mind as we go into this new year. People need to think about what their real goals are. And if goals are happy, healthy, and well-adjusted children, then individuals need to think about how to provide nurturing, loving care for the children. People need to start thinking about alternative forms of discipline. Discipline means to teach, okay? And so there are many ways to teach. And just like we expect children to use their words, parents also need to practice using their words with respect to children and becoming more creative in terms of how they address the development of the children. And as a community, people need to be more supportive of parents doing what is necessary to nurture the children. Nurturing children is not spoiling children. Nurturing children is caring for children. And we also have to remember, whatever energy we put out into the world is out in the world, and we will absorb that energy one way or another. And so those abused children of today are going to be the leaders of the communities and societies tomorrow. And so what types of leaders are we trying to develop? What types of older family members, because eventually they will be older family members, what types of older family members are we attempting to create? We also need to consider the issue of forgiveness, grace, and mercy. Oftentimes, adults are very in tune with the constructs of mercy and grace. However, they are not always as in tune with those constructs when it comes to children. Children are often given justice, okay? Whereas adults expect grace and mercy for themselves. And so as we go into 2025, it might be helpful for people to think very deeply about what type of world they are trying to create and what type of adult child are they trying to create. What is it that they want to leave in terms of their legacy in the world? Oftentimes, individuals will do things to children based upon what has been done to them. But what I want people to reflect on is, how did you really feel if that was something that you experienced? If you experienced spankings, when the spankings were taking place, how did you feel about the spankings? How did you feel about the parent who was giving the spankings? And if you are honest with yourself, you will probably reflect on not feeling very good about the spankings and not feeling very good about the parent who was dishing out the spankings. Remember, knowledge is power. Take care. See you soon.